Good morning. My name is Jason Osborne. I'm the Emergency Management Director for Harrington Hospital. This is John Musgrove, and we'll have a couple other people interacting with this video. We're going to be showing the proper use of personal protective equipment here at Harrington Hospital, and we're going to be using the GlowGerm product to show you how disease transmission and how some of these transmission modes happen and how we can prevent them. Again, my name is Jason Osborne. This is John Musgrove, and there's going to be a variety of others that are going to be coming through here. One thing we wanted to talk about initially is that 6-foot social distancing, okay? So right now, I am not 6 feet away from my partner, John here, and I am, excuse me, sorry. We're going to show you some of the proper ways to and improper ways to don and doff your personal protective equipment. We should always have a buddy working with us to try to help make sure that everybody is safe while we're putting on and taking off our equipment. As you can see, I'm in my full PPE with my eye protection, my N95, actually this is a KN95 mask, and my isolation gown, and I'm about to enter a potential COVID or COVID positive room. We're going to simulate with a GlowGerm how those molecules and how those droplets spread. So my partner here is going to spray at me, which would simulate droplets. Okay? So now I'm working with my patient and potentially exposed, but I'm wearing my proper PPE. Okay? Lights. As you can see, right now, you can see where that exposure and where all those droplets went on me. You can probably see it splattered on my face and on my gown. Okay, we're going to demonstrate the proper doffing of our PPE to reduce the risk of cross-contamination. We're going to turn the lights back on. Okay, so I would have my, trash can or receptacle. Let me bring the receptacle over. Okay, I'm gonna doff my first set of gloves. Okay, so now my inside of my gloves are a little bit cleaner than what I had before. I'm gonna foam my gloves at this point in time. Okay, I'm going to slowly start to tear away my gown, trying to reduce the risk of any contamination and turn it inside out. I'm going to slowly pull this up away from my body, again to reduce the contamination. I'm going to take off with my gloves, finger underneath, and into the trash can. Okay, my eye protection. I'm going to reach behind me. I'm going to pull this away from my body. And if you're going to be washing these and reusing these, they would go into an area where they could be washed and reused. Or if you're using a disposable, they can go right in the garbage. And again, the last thing I'm going to do is don my N95 mask. I'm going to take it without trying not to touch anything. Okay? Now, lights. We're going to see where that contamination, okay? John, where is that contamination right now?
On your right hand.
Okay.
Left hand.
And what do I need to do at this point?
Do good hand
I need to foam again, okay? And then I need to thoroughly wash my hands to eliminate that. If I touch surfaces, and we're going to go over this in a little bit on contamination of surfaces, that's potentially going to contaminate that. Working in the emergency room, I've just doffed my my PPE, and I haven't quite washed my hands yet, but my buddy John come in, and hey John, how you doing? How's it going?
Hey,
good to see you. Absolutely,
today,
anytime. Okay, and at this point in time, you know what? I got to pick up my thing here, my pen, and I got to go wash my hands. So I go and wash my hands. We just want to show you where that cross-contamination had gone, okay? As you can see, my hands, okay? Now look at John's hands. Okay? All that contamination. Oh my gosh, I just touched the table. Okay? This is where that cross-contamination spreads. This is why it's so important that we need to physically wash our hands. So at this point, I'm going to wash my hands, get my hands nice and wet. Okay? Should be at least 20 seconds, making sure we get in all the nooks and crannies of our skin. That's where stuff likes to hide. Rings, wrists, sometimes even watches. Just need to be careful. Paper towel to dry. Get that paper towel and throw it away. Now that I've thoroughly washed my hands appropriately for greater than 20 seconds, as we've seen, I'm going to enter back into the emergency department.
Hey, great job.
Oh, thank you so much. I appreciate it.
Only one thing, I haven't washed my hands yet from when you shook my hands.
Oh.
Sorry about that, man.
Now, look where we're at.
Second generation.
Everybody has to do their part. And if I don't know that John has not washed his hands, and I come over to Craig and say, hey, I just wanted to let you know you're doing a good job, nice job, okay? Now we're gonna look at Craig, and we have additional cross-contamination because I didn't realize that John didn't wash his hands. This is why it's important for everybody to practice good donning and doffing of their PPE, as well as good hand washing techniques to slow the spread of this virus and any other virus, including the flu, corona, and whatever else might be out there. So I've documented some stuff on the computer, and I have finished some of my patient stuff. I have helped a couple other of my colleagues with some non-COVID patients and everything. Wash my hands, intermittently here. I just got a text. Hold on. It's from our supply guy. Wants to know where all of his gowns went. Found them. Okay. Okay, I'm good. All right, so I just want to show you something. Is I didn't wash my hands before I took that text message, and we all have done this. Okay. Could you please? Now I've contaminated my phone. Myself included, that we all have done. During this pandemic, we need to be more cognizant of what we're touching, what we're doing, washing our hands. That's why it's so important. Because now I have my phone, I've just contaminated my phone. If I haven't wiped this down and everything else, I can tell you that I have a 6-year-old and an 8-year-old at home, and the first thing they want to do, Daddy, can I see your phone for a minute? Here you go. And what have I done to my family? Okay, these are some things to think about. I know we're kind of doing, some stuff. You'll see some stuff that'll be kind of funny and hilarious, and stuff that is serious. But the whole message to drive home here is we want you to go home to your family safe.
Good job, Jason. No way.
What to talk about is when we're going home, okay? My personal practice at this point in time is to take shoes and other things off in my garage prior to going directly upstairs, taking a shower before I interact with my family, okay? Shoes have always been a harbor, especially the bottoms of the shoes as we walk through. This is going to kind of give you an idea of what we're talking about. Okay, look at the bottom of my shoes. As you can see, that's where some of the contamination is. And if you look at the floor, this is where our contamination that we're seeing with the naked eye, but these are where germs harbor. And we want to make sure, again, we keep our family safe. So the simple act of taking a bleach wipe and wiping the bottom of your shoes or rinsing them off but not tracking them into your house.
This is good, Jason, good practice even before and after COVID-19. I know stories of nurses that have accidentally used their work shoes and walked across their kitchen floor and have toddlers and they picked up staph infections.
Exactly, and we don't want that. You don't want to bring home anything you didn't come to work with. Talking about masks specifically, okay, and how things are spread. A lot of us are wearing, both public and healthcare sectors are wearing masks to protect themselves and to protect others from them. But I want to demonstrate some of the cross-contamination and some of the things that happen when we improperly use our mask, okay? He's going to spray that stuff again. Okay, now I've got stuff on my mask, okay, and we're going to show you with the UV light of where these droplets, could be and stuff like that. Notice how there's stuff on my mask. So if I touch my mask, or I'm at the grocery store and I want to, oh, this looks good, I'm gonna smell that, okay, put my mask back on and kind of fidget around with it, put it up and, stuff like that. And a lot of people do it, and we, scratch our face, because we're a little itchy under this mask here, and we don't even think about it. The average person touches their face several hundred times a day and doesn't even realize it. But we need to be more cognizant of it. Because if I start touching my face and I, under my mat or stuff, now if I take my mask off, we see some contamination where my mask was.